So, how are you? Today, I want to talk about something universal, something that bothers everyone, and that is human health. Now, under human health, I'll be talking about um, what it really means to be healthy, talking about health, what makes you healthy. I'll talk about disease, I'll talk about the traditional wisdom of medicine, and of course, I'll talk about the modern healthcare system, right? So, let's jump right into it. What is health? What comes to mind when health is mentioned? Maybe energy, maybe balance, maybe resilience, maybe longevity. Yes, all that. When you mention them, you may not be wrong, right? But as I always maintain, health goes beyond a mere absence of disease. Health is actually a continuum that ranges from extreme illness to optimal wellness. Yes, what I'm saying is that you may imagine it having two pillars here. One is health, one is disease, and then there's a space in between them. Now, this space is, occupied by nutrition, social interaction, anthropogenic toxicants. So when we talk about energy, you talk about balance, you talk about longevity, you talk about, whatever emotions and all that, they can all be influenced by this, nutrition, by social interactions and all that. So that's what health really means. It's a continuum that ranges from extreme illness to optimal wellness. And this continuum is influenced by multiple interconnected factors. We mentioned some like nutrition, social interaction, and anthropogenic toxicants. I've done a video on that before, and you can go back to my previous video to watch that. So that's about health. Now, what about disease? Disease is not a sudden event. Disease is a gradual progressive process. Yes. So before the onset of your so-called disease, there's usually, unfolding scenarios, happening years, weeks, months before, the advent of that disease. It is not a sudden event. And I will want to add that there are two, disease orthodoxy essentially rests on two unwavering pillars of reality. We talk about nutritional dysfunction and then toxicity buildup. All I'm saying is that every disease originates from two sources: nutritional dysfunction and toxicity buildup. Either there is a depositions of toxins in your system or you are deficient in one nutrient or the other. Again, let's keep it at that. Let's go back to the modern healthcare system. Now, the modern healthcare system that we all practice today wasn't designed for you and I. It was designed for soldiers who were fighting in the battlefield. Yes, it was actually designed to keep soldiers on their feet, to get them back to the battlefield. It was during the Crimean War in 1853 to 1856 when a particular young lady called Florence Nightingale went to the hospital to, observe something. Florence Nightingale was more than a nurse. She was a nurse, a statistician, and a mathematician. So she went to the hospital to take record of happenings. And there she discovered a disconcerting reality. Reality that soldiers that were being brought to the hospital were actually dying more in the hospital than they were dying on the battlefield. And she attributed this disconcerting reality to overcrowding, to poor sanitation, to preventive infections, to a whole lot of things. So she adopted the revolutionary reform. And these reforms encompassed clean environment, organized care, detailed record keeping, among other things. So these reforms actually gave birth to our modern healthcare system. Now, from that reform, we begin to have emergency care, we begin to have surgery, we begin to have the use of steroids, the antibiotics, the chemotherapies, which are excellent in an emergency situation, in a crisis situation. But when you flip the switch and you truly want to be healthy, like you want to live long, you want to be healthy, right? You want to have a balance. You don't look up to the modern healthcare system because remember, it was designed to take care of crisis situation. But now you are not in crisis. You just want to live long. You want to be happy. So we look to what we call the traditional wisdom or the traditional model of medicine, right? So that's the way it is. Like in the hospital system, you go to the hospital when you are in a crisis state, when you are sick, when you are diseased. In the traditional wisdom or the traditional model of medicine, they believe that before the onset of this your crisis states, events must have been happening, unfolding before that situation. So they're basically giving that scenario. We have what we call the seven Ayurvedic model of seven Ayurvedic stages of disease. It's actually six, and the last stage is the death stage or irreversible stage. So let me walk you through the six stages of disease according to what Ayurveda. The first stage is what we call accumulation. Recall that I said disease orthodoxy rests on two unwavering pillars of reality: toxicity buildup and nutritional dysfunction. During accumulation, there is a mild buildup of toxins in your system, there is a mild nutritional dysfunction, and this may result in you having maybe mild digestive disorder, mood swing, just my thing that you may not really pinpoint at that this is essentially what is wrong with you. That is the accumulation stage, right? So the second stage is what we call aggravation. In aggravation, there is a moderate buildup of toxin. There is a moderate, nutritional dysfunction, which may manifest in confusion, in irritability, and a whole lot of that, right? The third stage is what we call overflow. In overflow, this toxicity will move from the site of origin into the circulatory system. So overflow or spread, or what we call prasara, there's a movement of this toxin, buildup of toxin from the site of origin into the circulatory system. So the fourth stage we call relocation. In relocation, these toxins will actually deposit into weaker tissues and organs. Yes, in relocation, toxins will deposit into weaker tissues and organs, right? And then from relocation, we have what we call manifestation. Manifestation, you begin to see signs, visible signs and symptoms. And it is at this stage that the modern healthcare system comes handy. That is when you seek for medical attention at stage 5. Now we have what we call stage 6, which is the complication or the diversification. In stage 6, there may be multiple organ involvement. There is a clear differentiated, symptoms in organs, in tissues. Multiple organs may be affected. That is stage 6. And then the stage 7 is the irreversible stage. The stage that when you enter into the stage, little or nothing may be done to actually salvage your situation. So from stages 5 to 7, the modern healthcare system may be very important, may be very high yield. But from stages 1 to 4, the traditional wisdom, the traditional model of medicine is actually very high yield, right? Now, the question is not which one should I choose. No, I've always maintained integration, right? Integration, we should go beyond the pro and anti-dialectics of modern healthcare system and then the traditional wisdom. We should be focusing on integration. The fact is that stages 1 to 4 deals with prevention. And there are so many interventions you can adopt to prevent disease. It could be meditation, it could be yoga, it could be sunbath, it could be intake of tea, herbal tea, it could be anything. And then when you are sick, when you are diseased, you can actually adopt the modern healthcare system. It is only by that we can have a harmony, we can have a complete, health. So today, I've talked about human health. And under human health, I have discussed health, I've discussed disease, I've talked about the traditional wisdom or the traditional model of medicine, and I've talked about the modern model of medicine. Of course, at the end of the day, I am advocating for a balanced healthcare system where you can integrate both the traditional wisdom and then the modern model of medicine, right? Although things are evolving, even in the modern healthcare system, we have, preventive cardiology intervention now. We have vaccination. They're all tailoring, towards, preventive medicine. But traditionally, This is what it means. The modern healthcare system is a crisis state, is a wartime medicine. It is designed for emergency and not for a day-to-day living. So I advocate for a harmony, I advocate for integration for you to live healthy, right? If you have not subscribed to my channel, please do so. And if you are not following me on TikTok, please follow me and like my videos. Your comments are all appreciated and welcome. Thank you.